there was a request to talk about or to discuss what after, what is life like after I go through the knife or whatever. So maybe Dr. Speca will tell us a little bit about this. Credentials, well, you are a adjunct professor in psychosocial oncology at the Department of Oncology, Faculty of Medicine, University of Calgary. That's a long handle. That's what it is. It is what it is. And you're also a clinical psychologist at the Tom Baker Center. You've been in this trade with your groups, your support groups, since 1993, I think it is, or perhaps even earlier. Yeah. So he's got two very popular groups. One is the Mindfulness-based stress reduction program, and a best supportive expressive therapy group for women with metastatic breast cancer. I don't know, is this the first time you've spoken to a prostate cancer group?
Yes, exclusively, although one of our early studies was half prostate and half breast cancer.
Okay, and we may hear a little bit more about that. He's a co-author of a book that I was encouraged to buy when Steve Bellway and I met Mike, and so his book is now in our library and available for you folks to borrow out, loan out, sign out, whatever the word is. Here's a mentor of Dr. Speca, and that name is something, Jean Kabat-Zinn. Close enough? If you give yourself over wholeheartedly to what is being offered in this book, it could make an enormous difference in your life and health in important ways, too numerous to count. The authors are committed practitioners of mindfulness and their mindfulness-based cancer recovery program. They're firmly rooted in research findings, and it radiates an authenticity that you can readily feel, and that will grow with time. Dr. Speca, the floor is yours.
So that was very kind of Dr. Kabat-Zinn to commend our book. He's a wonderful teacher and very famous for this concept of mindfulness. He published a book called Full Catastrophe Living, and I don't think I talked you into buying the book, but I did suggest it could be useful to your members. I'm always very reticent to commend my book when Dr. Kabat-Zinn wrote such an excellent book many years before ours, and the difference is that ours is focused on cancer, whereas his is more broadly focused on living with all kinds of stressful situations. So tonight I want to talk a little bit about mindfulness with you. I want to tell you about our program. I want to tell you a little bit about the research that we've done, give you try to encourage you to understand what mindfulness is, although it's very hard to fully understand it without practicing it. But we'll do a little practice too, if you're willing. And some ideas about how you can make it useful to yourselves, and maybe how to get going if you want to develop a mindfulness practice. So I'm appreciative of you coming out. Yes, the cold weather, and also the Westminster Dog Show is on TV tonight. But my wife is taping it for me, so I'll watch it later. So a little humor. I'll read the panels of the cartoon to you. Hi, we're here for the Happiness Through Meditation seminar. And they walk down and they see, oh, that was a typo. It's actually happiness through medication. And the girl says to her friend, I told you we should have gone to the movies instead of pursuing happiness. So I think one of the exciting things about this whole mindfulness business is it's something that you can do for yourself. You know, it's something you can take some control over. One of the aspects of having illness that's so difficult is you're reliant on so many experts and other people to help you and to support you and tell you what you need to do. And this is something that every person can do for themselves with a little bit of application of intention and practice. So this is something that, an area of your life that you can have control over. So some 20-some years ago, I was a therapist at the Cancer Center. I never intended to go into cancer as my area of work, and happenstance had it. There was a postdoctoral fellowship there, and I got involved through some odd circumstances, but I ended up being hired there. And so I was counseling patients to deal with many kinds of issues I'm sure you're more than familiar with. So these are common experiences of many patients. The whole threat to your life, the sense of mortality, the possibility of dying from your disease, which always comes into people's minds, even if it's not highly likely. The sense of loss of control, which I've mentioned already. The loss of certainty. You think you have your life planned and you know what you're going to be doing next year, and suddenly everything is thrown up for grabs. And the emotional consequences and the symptoms, side effects of treatment and so on. And lastly, the fear of recurrence. Now, so common for many of our patients. So I was working, doing traditional counseling around all of these issues with our patients. And one day, sitting at lunch with two of my colleagues, we were talking about our work and the stress it placed on us. It can be stressful. You get to know people pretty well. So in a way, you suffer with them through that. And over many years of working with people, it can be quite challenging. But we all discovered that all three of us had our own meditation and or yoga practices. And we wondered why we weren't teaching anybody to do those things, because that's what we did to cope. So we said, okay, let's do that. We developed a program and based on our own experiences. We ran a small clinical trial by a man who started his own foundation called the Alternative Cancer Research Foundation. His name is escaping me at the moment, but he's a Calgarian, and he gave us a grant of like $2,000 or $3,000, as I recall, to run a clinical trial. So we cobbled together a little clinical trial with a waitlist control condition. And we found amazing benefits to the program, especially in the realm of the emotional benefits of being in the treatment. People who took the meditation program had much less negative emotionality, greater sense of energy, and positive emotions, better quality of life. So we thought we were onto something. So that was in 1996. A year or two later, Linda Carlson came to us from, McGill, yes, right, McGill University. And she's a really keen researcher. She became a principal investigator on some subsequent research programs. And so we upped our game with regard to the rigor and the questions we were posing in our research. So we started that program, and then we started asking people, what in the program did you think was valuable? What did you benefit from the most? At that time, there was a meditation component, a yoga component, and some yogic breathing, sometimes called pranayama, different breathing techniques to alter the mental, emotional, energy state of the body. And it was funny because about a third of the people thought one of those aspects of the program was the most important. So we ended up keeping them all. Linda and I then went to do a week-long retreat with Dr. Kabat-Zinn. About that time, there was a program called Healing in the Mind on PBS. You may have seen that, where Bill Moyers went around the country and interviewed people doing kind of cutting-edge alternative and complementary medicine research and programs. And he featured Dr. Kabat-Zinn at that time. And I hadn't known about him before that. So Linda and I went and did a week with him, and we slightly modified our program to correspond. We thought, why reinvent the egg? Is that the saying? What's the saying? The wheel. So we modified the program just a little bit. It's open to cancer patients and their family members. We've had over 2,000 Calgarians over the years. And so we do ongoing programs, usually at least 2 a year in the fall and in the winter, spring, sometimes 3. And we marry it to research studies as we go. Just so you get a better idea of what the program is like, it's 8 weeks long and we meet for an hour and a half weekly. There's a bit of discussion or teaching in the beginning. Then we do some it's really gentle yoga. We think of it more as mindful movement. So you don't have to have a lot of physical capacity to do these things. It's just exploring what you can do, learning to relate to the body in a constructive way that kind of reestablishes a sense of trust after you've gone through an illness. And also teaches us to be sensitive to what's going on in the body generally, not just in a disease-focused way. And the meditation itself, which is in our program is a form of meditation known as mindfulness. It's similar to what some people know as vipassana or insight meditation. But it's a kind of meditation that's kind of transcends various traditions of meditation. Similar forms of meditation are done within different religious faiths, as well as in various schools of Buddhism. And during that 8 weeks, and hopefully thereafter, we encourage people to practice every day for at least a short period of time. And there are many research studies. We published the first one, I think it was in 2000, but since that time there have been dozens of others, and these are some of the findings. I don't want to, this group I don't think is keen to look at lots of graphs and charts of outcome measures, but these are the general ways of describing some of the findings. Improved overall quality of life, increases in the sensitivity to spiritual issues and an involvement in one's own spirituality, however you define that. Increases in post-traumatic growth. You may be familiar with that construct or that variable. Post-traumatic growth is this idea that sometimes after a traumatic experience like having cancer, it opens up new vistas in one's life that are often very advantageous, and we can measure that. People tend to sleep better. There's improvement in cortisol rhythms, and I'm going to talk a little bit more, explain what that is. Less inflammation in the body, which is something that can be helpful for many kinds of illness to reduce inflammation. Improved mood, more energy, less rumination, worry, and depression. Less experiential avoidance. I'll tell you more about that. And by the way, I'm happy to answer questions. I think Stuart would suggest we should probably wait to the end, but I'm okay with just speak up and we can address your questions as they arise. Decreases in stress and decrease in systolic blood pressure. Now, I mentioned this cortisol issue. Now, some people may be familiar with this, but we do have this hormone cortisol that's involved in the diurnal regulation of our physiology. So there's this normal pattern that we see. It's the middle one on this graph, where in the morning cortisol levels are very high and they decrease throughout the day. They're lowest in the evening when we're sleeping, and then they rise again towards morning. That's kind of normal for a healthy person. What we see with various kinds of illness populations is a flattening. So whether it starts low and stays low, or starts high and stays high, there's no slope in that curve, and so those are considered abnormal. We found that participation in this program helped to re-regulate and establish a more normal curve of cortisol, which you could take that as a kind of a proxy for how well the body is self-regulating and following normal physiological patterns.